I keep seeing Citrulline sold as the clean way to get a bigger workout pump. Is the basic claim real, or is it just pre-workout label poetry?
The pathway is real. Citrulline is absorbed in the intestine, travels through the blood, and is converted mainly in the kidneys into arginine. Arginine then feeds nitric oxide synthesis, and nitric oxide can relax blood vessels. That is why the supplement has a plausible pump story. But plausibility is only the first rung. A higher arginine signal does not automatically mean you squat more, run longer, or recover faster.
If the point is arginine, why not just take arginine? Is citrulline actually better absorbed, or did supplement companies just rename the middleman?
Citrulline is useful because it can bypass some of the handling that limits oral arginine. It is not heavily extracted by the gut and liver in the same way, so it can be a more effective way to raise circulating arginine. That makes it a smarter biochemical lever. Still, a smarter lever is not the same as a guaranteed visible result in the gym.
Then what about citrulline malate? People talk like 6 grams of that equals 6 grams of L-Citrulline. Is that label math wrong?
Yes, the math can be misleading. L-Citrulline is the amino acid. Citrulline malate is citrulline bound or blended with malate, so the full scoop weight includes both. If a product says 8 grams citrulline malate, you still need the ratio or actual citrulline amount. Single ingredient labels are easier to judge than proprietary pre-workout blends that hide amounts behind marketing language. Food matters too. Watermelon is a natural citrulline source, which is why it appears in discussions of nitrate, arginine, and citrulline foods for endurance. But food dosing is less precise than a tested powder, and whole food patterns bring other nutrients and volume. I would not treat a watermelon snack as identical to a measured supplement trial.
So when the studies test actual exercise instead of blood markers, what happens? Are we talking a real performance supplement or a small maybe?
The fairest answer is mixed. A 2026 meta-analysis of citrulline malate found a small overall performance association, but the certainty was low to very low. Prediction intervals were wide, and dosing or timing targets were not settled. Endurance reviews in young healthy adults also report inconsistency. Some short resistance studies look encouraging for repetitions or soreness, but the pattern is not reliable enough to call it a universal pre-workout upgrade.
Could the people who benefit be the ones with worse blood vessel function at baseline? Like, does normal blood pressure versus high normal blood pressure change the story?
That is an important clue and also a caution. In a 12-week trial, 3 grams of L-Citrulline improved flow-mediated dilation, mainly in healthy older adults who started in a high normal blood pressure range. That does not make it a blood pressure treatment. If someone is already using antihypertensive medicines, nitrates, or erectile dysfunction drugs, stacking vasodilating effects should be discussed with a clinician or pharmacist. There are also hints in specific groups, but they are not definitive. A small pilot trial in physically active older women used 3 grams per day of citrulline malate with exercise for 6 weeks. Sit to stand improved, and walking and physical performance scores trended in a favorable direction, but only 20 women were studied. That is hypothesis generating, not a green light for everyone.
What about clinical situations? I saw claims that citrulline helps endothelial function after illness. Is that relevant to a healthy lifter, or is it a totally different lane?
Different lane, but informative. In post-COVID syndrome after hospitalization, 4 grams per day for 3 months lowered ICAM-1 and improved 6-minute walk distance compared with control. That suggests vascular or inflammatory signaling may matter in some recovery contexts. But open-label design, illness history, and clinical supervision make it a poor shortcut for claiming a healthy person will get a bigger pump or better personal record.
If someone still wants to try it, how would they know it is helping instead of just feeling the ritual of a pre-workout scoop?
Use a boring metric. Pick 1 or 2 repeatable workouts and track total reps at a fixed load, time to completion, perceived exertion, and next day soreness. Keep caffeine, sleep, and workout timing similar. If after several comparable sessions nothing changes, expectations should change. Citrulline is more like a possible small edge in selected contexts than a supplement you should feel dramatically every session. The common short-term issue is gastrointestinal discomfort, especially when doses or blends are aggressive. Long-term supplemental safety is less characterized than short exercise studies, so product quality matters. I would favor third-party tested, single-ingredient products with transparent amounts. Athletes should be extra careful with multi-ingredient pre-workouts because undisclosed or contaminated ingredients can create sport eligibility and health problems.
So the red flag group is anyone already manipulating blood pressure or blood flow with medication. And citrulline should not be treated like therapy for rare metabolic or mitochondrial conditions, right?
Exactly. The bottom line is, citrulline has a credible body route and can raise arginine for nitric oxide signaling. Exercise benefits are possible, but small, inconsistent, and context-dependent. It is most reasonable for someone who can read the label, test a repeatable outcome, and stop if there is no signal. It is less reasonable as a mystery blend, a medication workaround, or a promise that blood flow chemistry automatically becomes better performance.